LDCT stands for lung cancer screening CT. It's a CT done for purposes of detecting early lung cancer before you develop symptoms. Lung cancer screening CT is designed for people who are high risk of developing lung cancer, and those people specifically would have a history of a 30 past year smoking history. There's different age criteria you can discuss with your doctor. The lung cancer screening chest CT is a very, very short exam. Once you're checked into our imaging center, the exam itself actually lasts less than 10 seconds. So one of the most important benefits of lung cancer screening CT is the detection of very early lung cancer before you develop any clinical symptoms. So this would allow us to do treatment or medical intervention in order to cure you of lung cancer. So for every 1,000 people who get screened for lung cancer, 3 lives will be saved. Without lung cancer, those 3 lives may be lost. One of the risks that people are most concerned about is the exposure to radiation from the CT scan itself. The first thing to know is that a CT scan does not leave radiation behind in your body when the exam is complete. The second thing about the dose of radiation you're exposed to is actually the dose of the chest CT is extremely low. It's about 1/2 or 1/4 what you would experience just living on the planet Earth. So, and it's also much, much lower than a diagnostic chest CT as it's designed specifically for lung cancer screening. Additionally, the radiation doses are tracked, and TRA actually has ACR accreditation to perform lung cancer screening, where we annually follow up all of our lung cancer screening doses and make sure that everyone meets criteria. Lung cancer screening chest CT is recommended to be done every 12 months or every year for people who qualify. Rarely do we recommend a shorter time interval to follow up if we find a imaging finding that might be of concern, but the vast majority of people get a scan every 12 months. Typically, your results will be available within 1 to 2 business days after you get the examination performed.